our continuing series of virtual voices. First, I would like to thank you for your comments and letters. We very much appreciate them, and please continue sending them. Our speaker today is Professor Mark Gregory Robson, who is a distinguished professor at the Rutgers University, but he has too many titles for me to list them all. However, he has been a speaker at many of of our conferences at the United Nations, and he has been on our board for many years. Our moderator is Apurv Kapoor Gupta, who's on our executive board. Apurv.
Thank you so much, Dr. Durbach and Mark. It's an absolute pleasure to have you joining one of our WIT Virtual Voices series. Everyone, as Dr. Durbach mentioned, Mark enjoys way too many titles for us to list. I think we'll finish the entirety of this webinar for that. But he is an absolute specialist in plant biology, in biological sciences, in plant science, agricultural science, public health, environmental health, just to name a few. But Mark, again, a pleasure having you here. Speak to us about this very important topic on the global food system. And with that, I hand you the floor.
Well, thank you very much. Thank you, Dr. Durbach, and thank you, Mr. Gupta. It's a pleasure to be here, and it's a privilege to be a member of the WIT board, something I've enjoyed for a long time and have met so many wonderful folks. Each one of the presentations before this one have been superb, and so I do hope to live up to the standards set by my colleagues. As our previous presentations shared, this is a really complex and far-reaching and very much an uncharted kind of pandemic. It literally impacts all of mankind. As you look at this map, you can see that there is really no place that isn't impacted. What I'd like to talk about today is to follow up a little bit on the other presentations where Dr. Ram explained the pulmonary issues around the disease itself, Dr. Goldstein on the policy, the ambassador sort of global implications from world leadership. And I'd like to drill down a little bit further and talk about what this COVID-19 does to our food supply and how the COVID-19 process has impacted things that we would think about, fairly obvious ones, and then some that are a little harder to think about, and maybe we can tease them out just a little bit. Think about this, that in 3 months' time, we have gone from unknowing this virus to just, extraordinary effects. This morning, I logged on to the Johns Hopkins website right before we went on for the webinar, and there are over 9 million cases, with 468,900 deaths. So this is really rather exceptional. Now, all of us are joining the webinar today online. We are telecommuting. I work at Rutgers University, but I'm teaching all of my classes online. But when you think about the people involved in the food system, they're not telecommuting. They're not folks that are online. They're folks that are literally in the field. And they're producing a crop that's highly perishable. It can't wait until you log online. You can't go back and look at the video. So the food system is much more complicated. In last week's New York Times, the chief economist for the World Food Program at the United Nations reminded us that the coronavirus pandemic was about to set off the next global hunger crisis. And he predicts that there'll be an additional 130 million more people who are in what we call in severe hunger. There are lots of hungry people, and we'll talk about that in a minute, but these are folks that are in severe hunger. Remember too that the folks that are in severe hunger are also the folks that are usually very poor. The virus has disproportionately affected the poor in our world and made their life even more challenging. Since I'm a college professor, I love to assign homework. I recommend to you, and it's available online at no cost, this excellent report. Every year they do a report, the Information Network on Food Security. And the 2020 Global Report on Food Crises is available. And it helps us remember where the pockets are even prior to COVID. Keep in mind, as you look at the folks that are affected by this virus, as Dr. Ram and Dr. Goldstein pointed out, They're folks who have lots of other comorbidities, vitamin D deficiency, they have diabetes, they have poor nutrition to begin with, they have hypertension. And so those folks are primarily more at risk to the COVID-19 problem than a normal healthy person. Then you add on the fact, when we look at global food issues, that just in the last year or so, we've become aware of the locust issues in East Africa. Some of this has been the worst locust infestations in 75 years. So already food was in short supply. And in several parts of the world, too, we've experienced extraordinary issues with cyclones and other serious weather events. So this has made it a very complicated thing. About half of the 8 billion people in the world live on about $5.50 or less per day. 10%, about 800 million of those folks, live on less than $2 a day. So again, we have folks that were really on the edge as far as food availability, and this just made it much worse. Sadly, the world does grow enough food. There is enough food available. It's the distribution that's the challenge. In earlier reports, when we would talk about food insecurity and people at risk, the main reason that people suffered food insecurity was conflict, followed by weather. And of course, in 2020, the #1 spot now is COVID-19. One of the other challenges that we have is, where is the agriculture taking place? And if we look at the screen or the data that comes from our world data set, you can see that a large number of people who are involved in the production of food, some 60% of the world's population depends on agriculture for survival, are those folks that are in the areas that are most at risk for COVID and for food insecurity at the beginning of this discussion. The other thing we have to remember is that when we have lockdown and we have agricultural workers involved in the food supply chain, they get immediately affected, okay? 94% of the global workforce, according to the ILO, 94% of the global workforce are in countries where the workplaces are closed, okay? And the ILO estimates that this 3-month shutdown we've had thus far is the equivalent of the loss of 305 million full-time jobs. So this is really an extraordinary thing, that folks are not able to go to work. They are, and when their workplace isn't functioning, of course, there's no income, there's no food supply. And since many of those places are in fact food production programs, either as a farmer or a food processor or someone hauling food, it affects all of us when we take it further out. Keep in mind too, that in many of these countries, when it's in lockdown, a lot of the children who are involved, who are already food insecure, receive their food, their meals from the schools that they attend, and the schools are not open. The other thing that we forget sometimes are the fact that poor countries rely very heavily on the United States and Russia and the Gulf countries for remittances. Now, some of you know what that means, and some of you, this is a new term. So remittances are where the expats, the diaspora from these different countries, the foreign workers who live, say, in the Philippines, 10% of Filipino workers work outside the Philippines, send back money to their home countries. Many of the African countries, the workers send back money to their families in the home countries. So when we say that the countries are heavily reliant on remittances, that means the folks that left the country and are working outside the country are sending money back. Under something like COVID, that's not happening. When there is no money to buy food, that exacerbates the problem. So again, you saw a minute ago where the agricultural workforce is. Now let's look at where people already are hungry. This is a hunger map from 2019. Map was drawn way before we even thought about COVID-19. And again, you can see the places that concentrated where people were working in agriculture are also the places that are most hungry. So this gives us one of these challenges. And we also see we have almost 1 billion people who are hungry, okay? The irony is, and as I've mentioned in other WIT presentations, when I first started to teach these kinds of topics, we always talked about the 800 to 900 million people who were undernourished, who did not have adequate calories. In the last 5 years, we've also added a new statistic about the 1.4 billion people who have too many calories, the percent of the population, the global population, who are in fact obese. But today we're going to concentrate on those folks who don't have adequate calories. The International Monetary Fund says that this number of hungry people is going to rise, and it's probably going to be, we're going to have the worst global recession since the Great Depression that took place almost 100 years ago. The United Nations, in fact, is suggesting that we're probably going to have a doubling of the number of people who are acutely hungry. Okay? So this is really, really quite interesting. So let's have a couple examples so that it will make a little more sense to us. Let's look at Zimbabwe for a moment. So Zimbabwe is a medium-sized country, just under 15 million in its population. That was the population as of this weekend when I was refining the presentation a little bit. Already Zimbabwe has suffered tremendously from climate crisis and incredible economic instability. The pandemic has just made the hunger problems so much worse. If we look at the numbers that the Zimbabwe government published, their own numbers, that in December of 19, they figured about 3.6 million people were acutely hungry. Their own numbers show that it's more than doubled as of 2 months ago in March 2020. So a dramatic increase. Already they've had extreme drought, the political instability, it's really pushed this number up. And then you go ahead and you look at other mitigating factors. The fact that the unemployment rate at the end of last year in Zimbabwe was about 11%. And that was a pretty good number. People were working hard to improve the employment numbers. In May, so just last month, it's already up to 90%. Most of this is a function of COVID-19. So when we think about supply chain and food distribution, some of us think about going to Whole Foods or Trader Joe's or maybe our local farmers market. And for those of us in the West, that's not uncommon. But for our international participants today, or any folks that live in more rural areas, that's not at all the case. Here is a market that I visited in part of my USAID Liberian project. This is up in Bolton County in Liberia. This is the supply chain. This is the distribution center. This is a very fragile and delicate system. And look at the goods that are for sale. The goods that are for sale are highly perishable. This is not a product that you're going to go ahead and buy in the freezer case that was processed in another country 5 months ago. This is something that's bought today and consumed today or tomorrow. So a lot of the food supply is handled through a very basic food distribution center, a very basic food distribution system, micro-agriculture, people that farm a quarter to a half a hectare, very small scale farmers, and it's very, very close as far as the way the profit margin goes. I mentioned earlier about the locusts, and just as, you know, the expression, just as if you didn't think it could get worse, it clearly could. And so this is a picture that came from through Reuters and the BBC. This is an example of, in Kenya, the incredible locust swarms. According to the World Health Organization and the World Bank, that this is the worst in Ethiopia and Somalia in the last 25 years. And the Kenyan government said it's actually the worst for them in the last 70 years. So extraordinary event. Ironically, the season started out pretty good. The weather and the climate was favorable. The rains were just right so that the crops were growing well, but those favorable rains also were rains that favored the increase in population of the locusts. So it was doing well for the crops, but the locusts took advantage of that as well. And so that was a great challenge for them. Across the 3 countries, 10 million people are additionally struggling from hunger now as a result of these locusts. And if these swarms continue, they expect that there'll be another 3 or 4 million people that are going to be driven even deeper into crisis. And what does all this do? So we talked about the supply chain, and the food can't get moved from place to place. We talked about, in the case of the locust, it doesn't even get produced because the locusts consume it before it is able to be fully grown and harvested. But let's extend it out a little bit. Let's look long term. Even prior to COVID-19, folks at the FAO, the United Nations Food and Ag Organization, noticed that there started to be an uptick in prices. Now, the uptick was seen as a favorable thing in general. It wasn't an extreme increase in prices, but you can see that prices were moving up for the producers, small farmers. That was a positive thing. And people were really feeling quite good about that. But sadly, when you do see an increase in the cost of food, that means for many people it is not as available. And if you look at the second graph in the lower half of the slide, you'll see that there is predicted to be an increase, and not insignificant increase, especially if you look in the last 5 years from 15 until 20, of the number of people who are going to be undernourished. So these things all track together. You know, the goal, of course, is to have a balance. And unfortunately, when extraordinary events like COVID-19 take place, this balance is greatly disrupted. Let's look specifically now at prices that are impacted by COVID-19. And in this 1 month period from mid-March to mid-April, you can see some pretty dramatic changes in price. And so here are 3 countries, Burundi, Rwanda, and Uganda. And every time that you see a red square in the graph, this means that there's been more than a 15% increase. Blue square means not much has happened, and a green, it's been very small, but the red and orange squares show either a 15% or at least a 5% increase. And these are in the major important protein and carbohydrate sources for the world's population: maize or corn, wheat, rice, green peas, and millet. So as you see, there are a lot more red and orange squares on this box than there are blue squares. And so that in that 1 month's time, we have seen a dramatic increase, up to 15% for some of these commodities. And according to the economists, this is directly as a result of the COVID-19 problem. Now let's look at one that is really striking. And this is a place that I've worked very long and hard in for over 30 years now, and it's the Kingdom of Thailand. And as you can see here in the Kingdom of Thailand, in the first quarter of 2020, the dramatic increase in the price of rice. Thailand was the world's largest exporter of rice. Now it's Vietnam, but Thailand is still up in the top 2 or 3 countries that export. Clearly, China and India grow more rice because they have much larger populations. But the Thai and Vietnamese farmers rely on rice exportation as a way to improve their income. Look at the dramatic increase in price. Realize, of course, that half of the world's 8 billion people get more than 20% of their daily caloric intake from rice. So they get half of the world's population, 20% or so of their daily caloric intake and their protein intake from rice. For about 250 million people that are specifically in Asia, it's more than half their calories. So when the price has this giant surge, as you can see here in this graph, it immediately impacts the availability of folks to get food and to maintain their health and to stay well. So here's a graph that comes from the United States. This is a compilation of data from the USDA and USA Today and other places. And I just wanted to show you that it's not a simple thing for one crop, okay? Eggs have become 3 times more expensive just in a 2-month period. A lot of that is because eggs are simple protein. When you think Americans are in their homes and they don't go out, and what's the easiest way to have a low calorie, high protein, healthy meal? You make eggs. And of course, eggs have gone up, as it says in this graph, about 3 times. A lot of meat has gone up in cost. It would have probably gone up more, except that people aren't going out. You know, about half the food supply in the United States goes into commercial outlets, restaurants and catering and commercial food supplies and school lunches and things like that. Schools are closed. Restaurants are not accepting patrons. Only this week are some states allowing people to dine, but on a very limited basis. So that food was redirected. Interestingly, when the food was redirected, the system couldn't handle the redirection. So if you are a food bank, in my community here, we have a food bank in New Brunswick where the university is located, and almost all of you probably have a place or several places that help people that need some help getting groceries in their community. And a lot of us volunteer on occasion in the food bank, and it handles a fairly steady supply of folks with a fairly steady supply of food. We were getting calls at the university by major food distributors saying, I have, a boat full of pineapples. That was a real call, by the way. One of my colleagues came and said, what do you think? The guy had a boat full of pineapples. Where could he send them? Because there was no place for them to be distributed. Another person said that they had, several container cars off an airplane of tomatoes. And the local food bank can take cases of tomatoes. They can not take container cars of tomatoes. So when we look at even domestically for the folks that are viewing that are in the US, even the best run food system, the best run food bank can't handle, extraordinary numbers of produce, especially because all these foods are so perishable. So they have a short shelf life that requires special storage. They need to be immediately distributed, and most places aren't equipped for that. So you can see that the overall had about a 15% increase in the volume of sales of fresh fruits and vegetables. But that was impacted a lot by the fact that there was almost a 50% decline in restaurant transactions. So it's a very complicated system. That was the point I wanted to make for you. Let's go back now to our on the global scale. And this is a shot I've been studying for a while with my graduate students in Southeast Asia, different impacts of agricultural production on farmers and farm families. And so here we are in Myanmar. Some of you know it as Burma. This is groundnut farmers. Groundnuts are very popular. They grow well in the monsoon and late monsoon season. We have edible oil, they're a food crop, and lots of small holder farmers in Myanmar grow these groundnuts for cash crop. But look how they're processed. Okay, again, for some folks in the United States in particular, where they have a vision, maybe they've not grown up on a farm. I actually grew up on a farm, and so for me, I have a pretty direct experience growing up as a kid on a small farm this type of which would not exist in 2020. In 1955, yes. In 2020, no. But that's why I so enjoy working with small farmers in developing countries, because it's a lot closer to the experience I had as a young person. These are folks who, this is a cooperative, these are folks who maybe have a hectare or even a half a hectare of groundnuts, and they're bringing them to process. This is not a great big tractor and 1,000 acres in the middle of Iowa or Indiana. This is someone who is probably brought those groundnuts by an animal cart or maybe a small motorbike. So you can see how the system works slowly, and you're not going to have enormous changes in volume or distribution overnight. What happened to these small farmers is the fact that they got the product there and then had no place to take it. That was the challenge that they faced. And so what happens then in a circumstance like that? One of the references that I was looking at, the title started out with "Pandemic equals migration." And, migration is another great challenge. We often think about migration as an outcome of climate change, because people have had to move, especially people in coastal areas, as we see rises in sea level. But pandemic and food also equals migration. The World Food Program estimates that for every 1% increase in the number of truly hungry people, and we talked about the fact that right now they suggest that could be upwards of another 130 million in the very short term, that there's almost a 2% increase in refugee outflow. So when we think about famines, it's a whole lot more than just not having food available. People are forced to move. It's about physical and economic access to food. And the other part of this is that a lot of those people are in agriculture. They need to plant, that's what they do. But they have to have access to seeds and fertilizer, and they have to have access to a market. one of the challenges that we see as we meet with small farmers is that they don't have access to a market. Then growing it and not being able to distribute it is even a bigger challenge. These beautiful women are in the middle of Niger. In Niger, the largest proportion of people involved in agriculture are women farmers. And so this is a group of folks that I've been working with. And one of the things that they said to me is that their biggest challenge was supply chain and distribution, that they can grow some spectacular crops with very careful irrigation and lots of hard work. They can control the pests. Resources are limited, so they are able to grow them organically and sustainably, mainly because they don't have the resources to put in those inputs. But they need to get it to the market. The onions that these women were growing in Niger took 5 days to get out and into the marketplace in Ghana. Okay, in 5 days, onions often are not in the best of shape. Okay, they've traveled in the heat, and they started out with a camel cart. Eventually, they made it to a small truck, to a big truck, and finally to the market. But in that time, they've had a lot of loss of the quality of the food. So, in addition to a food supply chain that's very, very vulnerable, also because of highly perishable commodities, they don't end up in the best of condition. They become unsaleable, and so the market is lost. In many places, there are reports in the last month or so, as this COVID-19 impact is even more seriously felt, that people are eating their seed corn. And sometimes you'll hear the expression, I had to explain this one time to one of my classes. I said, the folks are eating their seed corn. And they all stared at me and said, Dr. Robson, what are you talking about? And it's an old term. It goes all the way back to biblical times, that people saved corn for seed for the next year. During hungry times, the seed that would be replanted for next year's crop, if people got hungry enough, they would consume the seed corn. So that expression, the current application would be that people are spending all their savings, that they don't have any savings in reserve for a difficult time. If you're a farmer, you probably don't have any savings. What you've saved is seed for the next year. If you're hungry, you're going to eat your seed corn. And so what we found with a lot of folks, as we've looked at the pressure on the system, is that they're eating the reserves, they're eating their seed corn, and then when the time is ready to plant, they won't have anything to plant because they've consumed it as food as opposed to seed. So that makes it even more and more challenging. The other issue that we look at is just to step back and sort of recap why it's a bigger issue for the poor in the world, why it's a bigger issue for developing countries than for developed countries. If you are a poor person, you spend more of your income on food. That's just a given, okay? The main production factor that these small farmers have is their physical labor. So they have to be fit, they have to be healthy, they have to be able to work out in the fields. We've talked already about the fact that the disruption in the food value chain, the fact that that if you can't get to market because vehicles aren't allowed to travel. Interestingly, too, in some countries where they have decided to allow the movement of commerce, many small rural farmers are frightened to move into the larger cities where, in fact, the case numbers are so high. In rural parts of, for instance, Thailand is a good example. In the northern parts of Thailand, where it's quite rural and very heavily agricultural, the case numbers have been low. The number of reported deaths have been incredibly low. But people aren't excited about moving their commodity to transport their crop into the large urban areas where both the number of cases and resultant deaths have been quite high. So even now, if movement is allowed, there's a hesitancy on the part of the producers to move the product because they know they're going to be at risk. And in all of this, our public, social, and nutrition programs are all disrupted. And again, many, many poor people rely heavily on social programs to provide them with either food assistance or, in the case of children, for hot meals in the school system during the day. So like so many things, when we're talking toxicology, And there's several toxicologists on the talk today, including my good friend, Dr. Goldstein. We always talk about populations at risk. And of course, the populations at risk immediately are children, the elderly, women are more at risk than men, and immigrants. Surprisingly, as Dr. Ram pointed out in his presentation, this particular virus seems to affect men more than women. But normally when we say women, in a case like this, we're concerned about women, of course, women of childbearing age who are going to bring in, of course, the next generation. So let's just take a minute and talk about kids. Let's talk about the risks that they face. When we have a nutrition problem for a young person, okay, it's a lifelong problem, okay? If I'm hungry as an old person, okay, somebody who's over 65, you know, it might slow me down. I might not have the energy I want. I might be a little more susceptible to disease, but you know, it's not going to do any long-term damage. That's already been done at this stage. But if I'm less than 5 or 6 years old, everything about me is still growing. Children grow and develop until they're about 20 years old. And so any loss in not only calories, but also the nutrients and the vitamins and essential things for good child growth are going to be long-term problem. And so this beautiful little boy is a landfill scavenger in a place called Korat in Thailand. The large communities of families live on these landfills. Thailand doesn't do a lot of source separation. In fact, as municipal waste is deposited here on these large landfills, families of folks go through and remove the glass and the metal and the wood and other things that can be recycled. So this little boy, that's his occupation. He is a landfill scavenger. And he's about 6 years old when I took his pictures a few years ago. And, you know, when you take that group of kids, kids 5 and under, okay, we know that there are just an enormous number of people. You can see how this is broken out, the millions of folks. Hunger, when you look at the Food Security Information Network, they divide hunger into several tiers. And phase 3, of course, is the most extreme, but there are a number of levels. Suffice to say that, you know, any of these are ones that are quite serious. As I mentioned to you in the past, the concern was primarily, as you see here, that it was about conflict and insecurity, and then weather, climatic changes, and then economic shocks. Now that we have COVID-19, that's become the biggest driver in the system. So 1 in 4 kids around the world, this is a number prior to COVID-19, 1 in 4 children in the world in developing countries are stunted, okay? They need the right food and nutrients to get to their full potential, and they're not going to. They're not going to grow properly. Their brains, their bodies, so physically, intellectually, they're not going to develop at the rate that we would like to see for them to be healthy and productive citizens. And when you disrupt the food supply for a young person at that stage in their life, it really has long-term and far-reaching effects. So as we look at this, we say, gosh, this is just hopeless. What in the world are we going to do? Well, keep in mind that historically, the issue of pandemic is not a new one at all. If you go back to you know, the period of 540 or so, the plague of Justinian, at that particular time, they estimated that 25 million people died. This was later understood to be the Bubonic Plague, and it affected Europe and the Byzantine Empire, Mediterranean ports. In fact, it was suggested that in Constantinople, close to 5,000 people a day were dying when this was at its peak. So this is quite a while ago. We had a plague. I said, oh my goodness, I hope this won't reoccur again. Well, it did. Okay, then we fast forward, of course, to the time of the Black Death from 1346 to 1353. Again, the actual death toll is not known, but people estimate that it's well over 100 million people, and some people would guess that it could even be closer to 200 million people. At this time, it traveled on merchant ships transmitted by the fleas that lived on the rats, okay, and the rats that lived on the merchant ships. It impacted both Europe and Africa and Asia. And so you're like, well, that was pretty dramatic. You know, how can this be? Fast forward again to something that most of us who study public health have read about in great detail, and that's the Spanish flu. from 1918 to 1920. There, people estimate, so the first two, of course, were bacterial infection, the bubonic plague. The Spanish flu, of course, is influenza, that up to 50 million people died. And it was estimated that probably 500 million people were infected, and the mortality rate for this disease was about 10%. In each of these cases, the food supply chain was tested, the health system was tested. I put this one up in particular because it's been part of our news stories every day, those of us that follow this. And they talk about the first wave. Experts in this area, I'm certainly not an expert, experts in this area say, no, we're not talking about a second wave yet. Clearly, we are still in the first wave. But if you look at this Spanish flu, the flu of 1918, you can see that it had 3 waves. Now, this is data, just a small data set that came out of a publication that BBC put out to sort of chronicle the pandemic today and making references to the 1918, doing sort of a 100-year retrospect. And so here you see, this is just for Ireland, in Belfast and Dublin, so Northern Ireland and the Irish Republic. And you can see that there were, in fact, 3 waves and over a period of a 2-year time. So, as we go forward in this, we have to wonder where we're going to be if we, in fact, we have a second wave. Many European folks are very set on thinking that in October, they will see another major increase in cases and that the disruption will go further. So what's our goal? Well, our goal here, certainly the goal that Dr. Durbach has set in place for WIT and for all of us that are part of her team, is to look to the future. And here is the future. The future are these children that we were talking about throughout our presentation. And, if you step back and look at the distribution of the disease, one of the things that's very interesting, I hope you can see my hands in the corner in the little box, but, normally when we look at any kind of disease or pandemic, we often will look at how it's normally distributed, and we'll talk about the geriatric cases, the 5% over in this tail, and that includes me and a lot of people on this call, and the pediatric cases over here. Prior to the identification of a sort of unique problem that physicians are now recognizing in children, the majority of the cases were over here on this side in the geriatric cases. And so you might say, well, when you look at folks that were impacted by this, they were older folks, they were folks with comorbidities, they were folks that already had some health problems. And if you just look at it that way, sort of myopically, you miss the point. The point is that, sure, maybe these youngsters in this picture and youngsters all over the world are not going to have the direct impact of this coronavirus. But certainly the things that we talked about in the last 20 minutes about food supply, about proper nutrition for normal growth and healthy growth, and to be able to concentrate on their studies and to focus. One of the great challenges that people forget is that when your grandmother told you the most important meal of the day was breakfast, Grandma was right. Grandma was actually a great toxicologist. When she'd tell you things like everything in moderation, she knew what she was talking about. She maybe didn't understand dose that well, but she was a practical person. And the same thing is the case here. If children in school systems, whether it's in Thailand or it is in Liberia or it is in New Jersey, if children don't have a good breakfast to start, they can't concentrate and focus on their studies. It's their educational opportunities. They're going to lift them from poverty. It's their educational opportunities. They're going to move them forward. And so what can we do with this? Well, we have to hope that all of the 200 entities that are working aggressively to come up with a vaccine are successful. Other speakers have talked about why that's so important, and you and I know that's the same. The second part, of course, is, as many people have tried to hope that there become some herd immunity. We'll have to see whether that can take place. Right now, people are still trying through tracking and tracing and following up to see how many people actually did have the virus. There was a really amazing presentation the Boston Health Department, it wasn't a study, it was just an assessment. The Boston City Health Department went into a homeless shelter where they viewed folks and they just wanted to do a check and see how people were doing. And of course, folks in a homeless shelter are folks that are at risk. They don't normally have the best nutrition. They have, some comorbidities. And the health department went ahead and they tested all 390 some residents. Everyone was asymptomatic. Yet a third of the folks that were residents in that shelter actually were COVID positive. So, whether we get to herd immunity and how soon we get to it is also going to be a challenge. But what I'd like you to think about as I end, and Mr. Gupta will field some questions for us in the time that we have, is, that the food system that we are all part of is really one of the most critical parts of either stopping and managing this pandemic. And most importantly, the food system is one of the critical ways out. Clearly, the healthcare system is first. The healthcare system to go ahead and to assist people that are severely ill, to go ahead and to put in place vaccination and programs to both control the spread of the disease as well as to prevent further infections. But after we get past the medical aspect, the next part of this is going to be how we grow the food, how we distribute the food, and how we make sure that we keep folks healthy. So thank you very much. And I will turn it over to you, my friend, and you can field some questions for us. And we'll have fingers crossed that we can answer them.
Well, first, I would like to thank you very much for a lovely, very interesting and informative presentation. And of course, your pictures were excellent, and I certainly enjoyed seeing them. But I think one of the problems that I think we are experiencing right now is not only the problem of the food shortage, but the problem of so many people that we need to take care of. And since we're growing the population at a very, very fast rate, I sometimes believe that we would need three planets to feed all of the people that are born unless we completely destroy our Earth. So, as I said, your presentation was excellent. We learned a great deal about why and the reasons why there's food shortages. But one of the things that we need to keep in mind that the more forests, the more land we destroy in order to grow food, the more we devastate the earth. And it's not going to affect you and me, but it definitely will affect the future generations. So when I talk about children, I basically think about how we can make this earth more livable or to exist so it can feed the future generations.
You're absolutely right, Dr. Durbach. One of the challenges, even prior to COVID, is we saw in some of the pictures when I was trying to give perspective, is that already there were almost 1 billion people on the planet that were severely in food insecure, and that was a function of population. And that, as you might guess, for instance, the picture that is on the screen right now in Niger has the youngest population in the world. It has the highest fertility rate. And yes, while I am excited about working in that country, you also have to realize that if the population continues at a level to increase that it currently is, and in some of its neighboring countries, that no amount of technology and the kinds of things that many of us that are part of WIT do will help them out of the food crisis that's ultimately going to take place, because there's just not going to be enough resources to assist the large number of the citizens in that country. Absolutely.
Yes, that picture, one picture is worth 1,000 words. And as I was looking and I was thinking, my God, probably they're all from the same family.
They are siblings, yeah. Those beautiful little girls are all siblings, yeah.
The most important thing is to make sure that their mother doesn't have more. So we should be distributing with the food. We should be distributing nor plants. So, and that has been my theory for a long, long time. Anyway, upward to you. I'm sorry for continuing on.
No, excellent. I mean, Dr. Robson, thank you very much for sort of taking us globally throughout the journey and helping us spot some of the leakages throughout the food system around the world. I think before we go into COVID, we go into sort of other areas. I want to speak specifically about the food system, that you referred to. We have a food system that we've designed now, which primarily relies on some sort of 12 plants and 5 animal species. Its food consumption is expected to grow sort of by 35% in the next 10 years. And we also have a system where a third of the food actually gets wasted in the supply chain, sort of the perishable items, etc. What are some of the quick wins that can really be, that are required to fix this system to begin with? What can we do now? Can we change consumption habits? Can we change diets? Do we need to rely on other forms of food? I just want to get some of your perspectives on that.
So thank you so much. That's such a thoughtful assessment, and you're absolutely right. We, as developing countries become more developed, of course, the goal is to move towards a more Western style diet. There was an interesting discussion a while back, I think it was in the Wall Street Journal, that talked about just the desire to double the number of eggs consumed in China, a country with 1.4 billion people. And the notion that that would require 1.4 billion more chickens, which would require a lot of corn because chickens are grain fed. And so when you change food, you change food patterns and you change consumption patterns and go from a plant-based diet, which is historically an Asian diet, to more of a meat protein-based diet, the losses in energy are great. The number of resources are much higher. And so the trend would suggest even more pressure and a bigger carbon footprint. When you look at people's dietary patterns, we know that as we move away from plant-based diets, we find ourselves with really, really high carbon footprint for what we're consuming. And as you point out, there's about 5 or 6 animals and about 12 different plant crops. The other challenge is that we looked at the fact in this discussion, and other people have looked at it in great detail, half the world's population gets a lot of its calories from rice. We all grow the same white rice. If you go on the African continent and talk to traditional African farmers, there are some 300 or 400 different kinds of traditional African rice that is native rice species, but African people don't grow that. They grow white Asian rice. If you go to California, where we actually have a fairly large rice acreage, they grow white Asian rice. So in addition to having a pretty limited toolbox, all the tools are the same. So there aren't any quick fixes, to get to the point of your question. But long-term fixes, of course, we have to continue to look for more diverse crops. We have to continue to look for, as many good plant breeders do, we have to continue to look for crops that have, natural immunity to insects and pests. We have had a period of time in the United States where we've relied very heavily on chemical agriculture to resolve our pest problems. You only have to go back to the famous book in 1962 by Rachel Carson and look at what happened when we became so reliant. Chemicals are an important tool. They're a part of the toolbox, but they can't be the only tool in the toolbox. And so we have to work backwards and find plants that are going to have natural immunity to both diseases and to insects, and incorporate them back into our agriculture. It may take a while to do that. Plant breeders are the most patient people on earth. That's why I could never be a plant breeder. I remember in graduate school, several of my classmates being plant breeders, and by the time they got to retirement, my age, they might have had 1 or 2 big hits, even with all of the fancy molecular tools they now have. So there aren't any quick fixes. The one thing that we encourage people to do is to look more heavily towards a sustainable diet and a plant-based diet. And before I let you ask me the next part of that, I wanted to point out something that you brought up that was really important. And that was the fact that since the Second World War, we've had so much technology in our food system to stem losses. And you know, the amount of food that we lose to insects, diseases, and other pests has almost been constant since the 1940s. So we have a pretty bad track record. And the amount of food that we lose, we haven't done a good job trying to stem that number, to stem that loss. As I said in my talk, and kind of going to your point about how we're going to feed all these people, we grow enough food, we can't get it distributed. And we have to work on that. So the short-term fixes are to teach people value added and how to process locally. That group of woman farmers in the picture from Niger, we were actually working on a way for them to sun-dry tomatoes and then transport them, because the fresh tomatoes weren't going to make it. And it was very simple technology. The dryers are pretty straightforward. They're easy to use. They're solar dryers. So we're going to have to come up with some quick fixes. But even the quick fixes are going to take a while. But until we revisit an attempt at more of a plant-based diet, it's going to take some time to fix it. And of course, it's very easy for someone sitting in New Jersey who's overweight to say, oh yeah, you shouldn't eat that. But now if I'm the person in a developing country who says, no, I'd like to go ahead and change my diet and increase my caloric intake, I have absolutely no right to make that statement to that other individual.
Mark, what is your thinking about the genetically modified and how it's used in the farming?
So GMOs, are another tool in the toolbox. And a lot of people would argue that genetically modifying crops goes back to the early farmers 10,000 years ago when agriculture started in the Fertile Crescent. That farmers deliberately made selections of crops that produced more, or animals that looked stronger, or cows that gave more milk. And so that it's not been a new concept. What's been new, of course, is what's taken place since the 1970s, when people inserted genes or went ahead and altered the metabolism of certain plants and animals to take advantage of either nutrients or growth hormones or pesticides, herbicides in particular. What is a problem with that? While that has greatly increased production in the developed countries, like the United States and Canada and Brazil and places like that, large agricultural countries, it hasn't done a lot to help the small farmers that are represented in some of the slides in this presentation. They don't have the money to go ahead and to buy those expensive seeds. They don't have the pesticides. If you buy a glyphosate-ready corn, in other words, you plant the corn and then you apply glyphosate, the herbicide, over the corn to control the other weeds, these are farmers who don't have the money to buy the glyphosate, genetically engineered corn, nor do they have the money or the skill or the equipment to apply the glyphosate. So in a lot of the developing world, those GMOs are not really part of their long or short-term plans. And because farmers historically save their own seeds and things, some genetically modified crops, you can't save them from year to year. And other seeds, of course, there's even copyright infringements and things. So it just doesn't fit into this scheme very well. It's more of a developed world, more corporate agriculture approach.
That's very helpful, Mark, to understand sort of, all the tools that we have in the toolbox and whether they're sharp enough against our problems or not. Throughout your presentation, you focused more on sort of like the people agenda, whether it is malnutrition, whether it is sort of financial insecurity that people could face because of rising crops, etc. I want to sort of, when we think about the UN's agenda, we think of people, planet, peace and prosperity. So I want to move focus from the people agenda to the planet agenda as well. Food and the agricultural sector is extremely is an extremely high impact industry towards climate change, and is a very heavy emitter as well. a majority of those emissions do come from sort of meat production, as you were explaining with the chickens. But to what extent do you feel that we can now utilize the COVID-19 pandemic to refresh our food systems in a way that is more accommodating to the next crisis, climate change, which is fast approaching us as well?
So I think, thank you for that. I think that two parts in the few minutes we have left. The first part is, you're right. I think that this certainly absolutely gave us pause because we had no choice. The whole world is paused for 3 months to stop and take stock in how we do a lot of things, whether it's better air in Los Angeles or Beijing, or whether it's, you know, why we can't have animals and why we need to move to back to more plant-based things in the middle of Central Africa. So the short answer is yes, I think that we can go back and utilize the agriculture. You know, agriculture, while it is a contributor, transportation, of course, the largest contributor, but while agriculture is a contributor to climate change and carbon emissions, it also carbon capture and carbon going ahead and carbon sinks in agricultural crops can also be a very important mitigator. So I think that it's a chance for us to rethink how we prioritize this agricultural production. Since we have to rethink it now anyway going forward, let's think about agricultural activities that will in fact be carbon neutral or even be positive towards sequestration. And with that, that's like the use of cover crops. You know, in lots of places where they just clear cut and burn and don't do anything with the crop residues and don't have the opportunity to let the soil be a carbon sequestration tool, that's added to the problem. Agriculture has a really wonderful opportunity, both small scale and large scale now, to get on the positive side of affecting climate change and to improve, a reduction in emissions. At less animal agriculture, of course, is going to improve the reduction of emissions. And finally, the opportunity to go ahead and to say to people, you know, knowing that the food chain, supply chain is so vulnerable and that we're not going to be transporting this stuff all over the place. Let's go ahead and tighten up the markets and try to just even have people buy more locally. That will have a dramatic impact. When you think about the fact that you might have a sandwich today, a tomato sandwich, and well, if you had it last month, maybe not this month, people start to have tomatoes on the East Coast now. But last month, if you had a sandwich with a tomato in it, your tomato probably had more frequent flyer miles than most of us on this talk. And so, you know, it's a chance to go ahead and revisit how we eat in the developed countries and certainly in the developing countries to better enhance local markets and ways to do value added.
And that's a really interesting perspective, that instead of reducing the amount of farmland, you suggest that we just improve our transportation system, which will not only help the climate, but also will help the local populations. It's a very interesting perspective, and I didn't think about that.
Well, you know, we have to do something about this migration. I mean, to the other part of that, which is part of climate change, is, you know, that as we see increase in sea level rise, I think we have to make the case to these small farmers that, you know, that they have to understand that their farming activities are part of the catalyst for their migration, for this disruption in their lives, and when you go into the larger urban areas for the unemployment. You know, when people talk about an unemployment rate of 5 or 6%, that seems kind of abstract. But if you're the unemployed person, the unemployment rate is 100%. And so when it's 100%, people are going to pay a lot more attention to it. So I think we've come to our end. And I want to thank the people who were kind enough to listen. You can go on the link and you can find me if you have a question or a comment or a disagreement. And I would look forward to any of those. And thank you again, Dr. Durbach, as always, for the privilege to be part of WIT and to be your collaborator. Thank you so much. I wish everyone good health.
Thank you, Mark. The same to you. As usual, all these years, you have been a continuous supporter of our efforts to improve the life for future generations. So thank you very much. Harper?
Thanks so much, Mark, again, for joining us, being part of our series. Everyone, you will have a link to the recording of this webinar. Our next speaker is going to be Dr. Brian Landsberg, and he will be speaking with us on Friday, the 26th of June. So please stay tuned. Thank you for your participation, and we look forward to being joined by Dr. Landsberg on Friday. Thanks, Mark.
You're welcome.
Bye, Mark.